Courageous with an ebullient personality are just a few words to describe Nicola Schultz, who has been living with thyroid cancer for over 9 years. How did you know that you had thyroid cancer?
I had overactive thyroid first. In 2010, I was diagnosed with overactive thyroid. And 2013, I think it was, I noticed a swelling in the throat. And people say it was goiter, and different opinions they were having. But then I was reading the newspaper. There's always the health article in the newspaper. I was reading the newspaper, and everything that the doctor was saying about the thyroids and overactive thyroids and going on to thyroid cancer and things like that, I was experiencing the tiredness, lack of appetite, loss of weight.
After conducting some tests, Schultz was recommended by her doctor to undergo a surgery to remove the affected thyroid glands.
When Dr. Amir did the surgery, well, it was the right side thyroid, said he had to take it out. So I said, okay, no problem. But then when he did the surgery, he noticed there was lumps in the left side of the thyroid too. So he took out the entire thyroid and sent the lumps to biopsy testing. That was in October. I had the surgery of 2014. And in December, the first week in December, I think, I had to go back to the clinic. He said, my results are in, so I need to go back. And I went back, and that's when he said it came out positive for thyroid cancer.
Thyroid cancer occurs in the cells of the thyroid, a butterfly-shaped gland located at the base of the neck, just below the Adam's apple. The thyroid produces hormones that regulate your heart rate, blood pressure, body temperature, and weight. In most people, the thyroid cannot be seen or felt. It has two lobes, the right and the left, joined by a narrow piece of gland called the isthmus. Schultz explained that her life changed drastically after she was diagnosed.
For me, taking out like they say, the butterfly glands, that's what they call it. I had to lose my butterfly so that I can live. And I have to live on levothyroxine for the rest of my life. Every morning I have to take a tablet. So recently they had to increase the dose because my TSH was high. So, and I'm still feeling the tiredness, headaches, you get a lot.
While the mother of 3 is in remission, she still has to travel to Trinidad and Tobago regularly for treatment.
Even though I've been cleared of cancer, I have to keep checks because they said thyroid cancer can't come back. So last year I was cleared of cancer, and this year again. I'm not cancer free as yet, but I can safely say that I'm a cancer survivor. Until next year, after 5 years of treatment, then I'll be free of cancer. But then I still will have to go back to Trinidad probably every 2 years to get a full body scan.
She further opined that there should be more facilities in Guyana that offer care for cancer patients.
No thyroid patient can be treated thyroid cancer. Okay, the early stage can be treated in Guyana. You have to go to Trinidad or to the US. They need more. And like for instance, my treatment is the 131 radioactive iodine. And I have to go all the way to Trinidad for that. You can't get it here in Guyana. It's like, for instance, our president now, he has to go to Cuba for treatment.
Her advice to current cancer patients is that there is still life after diagnosis.
But I like to say to others that don't give up, don't lose hope. Some people, when you hear cancer, you think it's a life sentence, or you're dead already, as some people would say. But it's not. There's life and hope after. But the support system, you need support too. In any type of cancer, you need the support from family, from friends, and children if you have.
May 25th is designated as Thyroid Cancer Awareness Day. Thyroid cancer is linked with a number of inherited conditions, but the exact cause of most thyroid cancers is not yet known. Tamika Rodney reporting for HGP Nightly News.